There has long been a question whether anti-angiogenesis agents would add anything to a backbone of cytotoxic chemotherapy for metastatic gastric cancer. The AVAGAST study, which came out a couple of years ago, which was a platinum-based chemotherapy backbone plus or minus bevacizumab, was actually a negative study. And this was over 300 patients on that particular study. And it did not meet statistical significance, that there was a trend for improvement in that particular study. The primary endpoint for that study was overall survival, and the arm with bevacizumab was 12 months for median overall survival, and the arm without bevacizumab was about 10 months. But it didn't meet statistical significance. So we were already conducting our study with bevacizumab, capecitabine and carboplatin when that study came out. But interestingly, with the AVAGAST study, there were really big regional differences, as that was an international study, and patients enrolled on that were actually predominantly from Asian countries. And a real minority of patients were from the Americas, North America, South America, and then another proportion from Europe. I think what we have learned from that AVAGAST study and now really are applying to how we design trials for metastatic stomach cancer is that there are such regional differences and there's so much heterogeneity in gastric cancer that it's probably not a single disease. And so though the AVAGAST trial was negative, I think there's still a lot of interest in angiogenesis inhibitors. So we have since completed our study. Again, it's a small phase 2 single-arm study. Our particular study did not meet its primary endpoint. The primary endpoint was looking for an improvement in progression-free survival. Though actually our median progression-free survival was about 9 months and our median overall survival was about 14 months, which really are quite a bit longer than some of the historical controls. I think we if I'm looking back retrospectively in terms of the design of the study, we probably picked the wrong endpoint in terms of progression-free survival.